Cuba's well-traveled medical brigades have a long history. Some 400,000 doctors and health specialists from the island have deployed on medical missions to more than 164 countries over the past 5 decades.
This is a tradition for our health professionals here in Cuba since the 1970s. I can recall my parents serving one of the first Cuban medical missions, so we are all very identified with offering solidarity and support to other nations.
Some medical missions to disaster zones and low-income nations are Cuban-sponsored, while countries with greater means pay to receive the services. The revenue, in turn, contributes to Cuba's economy and helps fund its free public health system. Nearly 30,000 Cuban doctors were already spread out across 59 countries when the COVID-19 pandemic began, some fighting Ebola in Africa, cholera in Haiti, and other health challenges. The Cuban support has been acknowledged by patients, governments, and international organizations.
The Cuban doctors' work is highly praised because they are not only academically prepared, but they also offer solidarity, humane support, and integrity, because the human being is their priority along with saving lives.
Since the COVID-19 pandemic began to hit the world, over 3,000 Cuban health specialists have joined more than 40 medical missions to help other countries fight the disease. While countries continue to request Cuban medical support, the U.S. Trump administration has used its influence to discourage and discredit the missions, describing the doctors who take part as victimized slaves of the Cuban government, a notion wholeheartedly rejected by Havana and doctors living on recent COVID-19 missions.
Salimos de este país comprometido lo que vamos a hacer.
We left our country voluntarily and committed to our goal. We keep our full salary in Cuba as health workers, and I can say that the only country in the world whose doctors and nurses risk their lives for other nations is Cuba.
To send so many doctors abroad while keeping its island-based healthcare services up and running, Cuba has long prioritized the training of health workers. Here, there are 9 physicians for every 1,000 inhabitants, one of the highest rates in the world. In Havana, Luis Chirino for CGTN.